up, everybody? Welcome to the Better You Project, optimizing health, hormones, and aesthetics. And today I have a awesome nurse practitioner that I've been so privileged to get to shadow in Atlanta. I have Melissa Selby on the podcast today. She is an Atlanta native who attended Westminster High School, graduating from UGA with honors. She received her master's at Mercer University, Summa Cum Laude. So she's really smart. Melissa is board certified and fellowship trained in Functional and Integrative Medicine by the American Academy of Antiaging and Regenerative Medicine. So she's big stuff. She has a Peptide Certification through the American Academy of Anti-Aging. So that's A4M, as well as in regenerative medicine. She has a special interest in insulin resistance, autoimmunity, fertility, hormone replacement therapy, Lyme disease, CIRS. So some of the stuff we do not do, but she is a guru in all those things. She is married to her husband, Scott. They've got two beautiful boys, Baker and Carson. She loves her family. She loves Vine Medical. She loves Suzanne probably as much as I do. She bakes bread. She comes to work with little globs of dough and kneads the dough. And I was like, she would totally have survived on the Oregon Trail if we ever had to do that. I would be dead the first week. I'd probably die of tetanus. But anyway, she's fantastic. She's a good human. She's a good person. I so enjoyed spending 2 days with her and Suzanne. I can see why they work so well together because I think so highly of Suzanne, and just spending that little bit of time with Melissa, I thought was great. So are you ready?
I'm ready. Thank you for that intro, Lexi. I'm so happy to be here.
Yes, me too. So if you're new to this podcast, one of the things that I have done an old episode on is a little bit like a snippet of neurotherapy. Melissa is going to put it to shame today, only because she is
just
so
elaborate.
knowledgeable.
We're just elaborating.
She's so knowledgeable. I got to see her with patients, and I feel like one of the things that I really pride myself on is I call it the art of the consult. And so meeting the patient where they're at and really making them feel comfortable and at ease with all these crazy therapies that we try to throw at them. And I feel like Melissa is like the pinnacle of like calm, relaxed, and like just very approachable to her patients. And so we're going to dig into neurotherapy. So let's start off with, first of all, hold on, let's backtrack a little bit. How did you get into integrative medicine?
So I got into integrative medicine when going through my master's degree. I realized how poorly our allopathic system managed diabetes. That was what I did my master's presentation on. So did this presentation, left school thinking there's got to be more out there. I was already interested in nutrition, just knew there had to be something else. And then found this dream job position. It was truly an answered prayer to get to find Vine Medical. And I've been here for almost a decade. Have received the functional medicine training here. So allopathic background, functional alternative medicine here. And actually, I have found that the two marry quite well, or they can be married quite well. So it's just been kind of an on-the-job learning experience and such a blessing for me.
Yeah, absolutely. And so she's trained and learned from the best, which is Suzanne Faree. So she's been on this podcast a couple times. She's my like adopted mentor, whether she wants to be it or not, she's it. So anyway, we'll move on. So let's talk about a brief history of what is neurotherapy and how do you use it in clinical practice?
Absolutely. So the history of neurotherapy is actually pretty synonymous with the history of the development of procaine. We first found cocaine. That was the original anesthetic. But of course, it was quickly realized that was toxic and addictive and vasoconstrictive, things we don't want in an anesthetic. So in the early 1900s, Einhorn is credited for developing procaine. And shortly thereafter, physicians were publishing on seeing wounds heal faster. The famous French surgeon Lariche was credited for doing the first published stellate ganglion block to treat a migraine. He called Novocaine his bloodless surgeon's knife. So it was starting to gain some popularity, but of course they didn't have the communication tools that we have now. So most of these studies were actually done independently. These doctors weren't speaking with one another. The two, though, that are credited with the origin of neural therapy are Ferdinand and Walter Hunecke of Germany. They published in 1928 the unknown distant effects of the local anesthesia. They were using procaine for pain-related conditions in their patients, and were surprised to see a term that they coined called the lightning reaction, where the pain relief would be lightning fast. Sometimes pain relief would happen in distant areas of the body that they did not expect were connected. And even more general symptoms like, migraine headaches and other issues were just having remarkable turnaround with procaine. So they built upon that knowledge. And again, they're technically known as the founders of neural therapy. So it's been around for over a century.
Yeah. Isn't that crazy? I feel like so many of the things, Melissa, that we get to do in clinical practice have literally been around forever. And people are like, is this new? I'm like, no, we're just catching up,
Yes, exactly.
So it's absolutely true. So when we talk about procaine, right, we think about anesthetics, just as you mentioned. So when I talk to patients about this, I'm like, it's kind of like a sophisticated older sister of like lidocaine, or, dentists who use bupivacaine or sensorcaine. So it's in the anesthetic. And I remember specifically 2 years ago hearing Suzanne talk about this at A4M. And I think she was talking about it in regards to joints. And I'm like sitting there, I raise my hand. I'm like, okay, wait, I'm just making sure I'm like understand what you're saying here. So we're using procaine as the intervention and not just the anesthetic. And she said, yes. And I'm like, what? So of course, I'm like, let me get into PubMed here. I don't know what she's talking about. And so of course I went in and I was like, well, I'll be damned. She is 1000% correct. Which I thought was so fascinating because I never heard it before. It wasn't honestly until A4M and Suzanne on stage. And I'm like, oh my God, like this is actually the intervention. So when you said it's like the surgeon's knife, I'm like, yeah, makes total sense.
It's extraordinary. And we don't use it in this country. It has fallen in popularity because it is short acting, which is actually its safety feature, but we'll get into that in a minute. So for dental work, certainly for anesthesia for surgery, even the American version of injections like the stellate ganglion block, it has been, the protocol has been developed around longer acting anesthetics. And that's actually slightly in contradiction to the wisdom that these physicians had a century ago in Germany.
Yeah, absolutely. Absolutely. Okay. So we talked a little bit about the history. Let's talk about some of the conditions that you in clinical practice use it for.
Okay. So the list of clinical indications is so long, it may seem that I am exaggerating, but truly, it would be easier for me to say the single condition I would not use it for is an active cancer. That's literally it. So the conditions, though, that I use it most commonly for in our practice would be mental health conditions, depression, anxiety, PTSD, insomnia. Many post-COVID syndromes, brain fog, migraine headaches, anosmia, chronic fatigue, and then pain syndromes, especially I've had most success with pain that evolves with a traumatic experience, such as a surgery. The actual physical tissue appears to have healed. Imaging studies may show nothing. But the patient said, I still hurt there, or I'm still numb there. So it can be an under or over functioning nervous system message. And procaine is just incredible for that. Painful menstrual cycles and mood swings related to menstrual cycles, IBS, again, all kinds of pain syndromes, painful scars. So I could go on and on. It's a pretty big list, but if I were to nutshell it, it's mental health and pain, but it's more broad than that.
Yeah, absolutely. So I was talking to our medical director, and he said, and he's a cosmetic surgeon, so he's like, from the neck up, and he's like, I'm sorry, ma'am, what are you doing here? And then we talked about it. And I said, it falls in line with our women who are perimenopausal, menopausal, anxiety, depression, post-traumatic stress disorder. I also read a study about utilizing it in vasomotor symptoms. So maybe women who don't want actual hormones, this would be a potential way to manage that as well. In the lower half, so we kind of talked a little bit about the stellate, which is a injection in the stellate ganglion, which is it's like kind of like the side of your neck, kind of behind your carotid, like where there's your sternocleidoid mastoid. It's like right under there. Yeah,
it's right there.
Yeah. So if you are listening and you want to see where Melissa just pointed, you need to go to the YouTube channel so you can see exactly where Melissa was. But what I also found fascinating when I was observing you guys is you would do an injection of procaine in the celiac plexus, which we do a ton of gut health. And so you were explaining like this could be great for irritable bowel, inflammatory bowel, constipation, bloating, gas, indigestion, diarrhea. Is that kind of the majority of what you're looking to achieve with the celiac injection?
Yes, absolutely. So functional medicine has done a wonderful job of acknowledging the importance of the microbiome and its effect on gastrointestinal health. But if the issue is actually poor gastrointestinal cell health that is causing the microbiome to be disrupted, you can throw fiber on that. The patient's just going to get bloated. You can throw probiotics on that. They'll either do nothing or make the patients feel worse. So sometimes, sometimes our traditional, even functional medicine approaches are still too short-sighted. If a patient is just stuck in consider it like a stressful, broken record of the nervous system's innervation of the gastrointestinal tract, then we need to be able to reset that for them, literally improve blood flow and cellular function. And then we actually create a healthy cascade. So those supplements, if we even still need them, will now work because we've created an environment where the lactobacillus wants to thrive. Just as an example. So it's
absolutely
looking at it from a different approach.
Right. And then the other injection that I thought was the most eye-opening was the patient you had who, what did she say? She's like, this is what I look forward to in my entire month. And it was the inferior hypogastric injection. So this is, why don't you explain it? It's like in the pelvic region.
Yeah. So I just call this the pelvic shot for my patients. And I go through the inguinal canal region. So it's above the pubic bone. So toward the pelvic region. A neat thing about all three of these shots is they're almost painless. So that's awesome. I know that pain of shots is often an intimidating factor. But just a little interesting side note. So what I'm doing is I'm placing procaine around a hub of nervous system tissue. So this hub there's, we do stellate for chest up, we do celiac for abdomen, and then we do this pelvic shot for anything having to do with the pelvic region, be it the female organs, prostate, bladder, even a lot of lower back pain can come from this. So the patient that Lexi is referring to had struggled with even PMDD at her worst point when she first came to see me, and it was pretty severe. We did a single treatment, and the PMDD disappeared and has not come back. Now, I don't mean to paint this as a miracle therapy. It is absolutely incredible. And I want to just shout it from the rooftops how amazing it is. That is an extraordinary story, but I also don't mean to paint false false expectations for those who are considering of incorporating it and saying, well, she said one shot cured her of this serious mental condition.
Oh, absolutely. Absolutely.
But it is a true story that I got to witness. I'm very blessed. Yeah.
So I'm thinking about patients with PCOS, as well as endometriosis. I think that can be super, super helpful for those types of GYN type issues. Again, kind of coinciding with a lot of what I do in clinical practice is the female stuff. So I think that could be be super, super helpful. The other thing I also read about is like in male sexual dysfunction, because procaine can also have a nice effect of improving blood flow to different parts of the body. And so when we think about underlying etiologies like erectile dysfunction, which a lot of times can be a vasoconstriction process and poor blood flow, this could also be another option in the pelvic region in order to improve blood flow to that area. That can be super helpful. The other thing that we also see, and we do a lot of men's health too, is performance anxiety. And it's like, well, what came first, the chicken or the egg? Like, am I nervous that I'm not going to perform well, or am I not performing well? And then it's like making me nervous. And it's, so it's kind of like one of those that it could be a way to help, in addition to some of the other tools that we use in our toolbox to help with some of the erection type issues. And not only that, like good prostate health, I think would be benefited from it as well. So,
absolutely.
So I think there's so many things, and like kind of what you and I were saying when I shadowed you, it's like, when in doubt, just procaine it out kind of thing. We'll see what happens. In our practice before I started doing the stellate, which you'll be proud to know, I've done like 12 of them now.
Awesome.
Yes. We did a lot of neural therapy in the IV format. And coming from the Midwest, one of the benefits that I blew my mind how well it worked was seasonal affect disorder. In that, like right after December, from like January to about March, it gets cold, it's dark, it's like below zero up in the Midwest. And so the amount of patients who saw so much benefit from the IV version of it was incredible, was really, really incredible. Which I think is really, really cool. What I will say again, after now having observed you guys, have done it to some of our staff, and some of these staff have had IVs as well as now the stellate. What they like about the stellate is that it's a little bit more of an immediate effect versus the IV. And I'd be curious to hear your feedback. But they also said is that you get kind of like this woozy feeling with the IV that you don't get with the stellate. Like you're just calm. Mm-hmm. So has that also been your experience as well with your patients in comparing the two?
So I like both because I do appreciate that, especially when we're dealing with mental health conditions, the thought of having something invasively done, which I understand the intimidation factor of receiving a stellate. The workshop that I attended to learn how to do it, that was it. We did one and we received one. So I remember that feeling of, oh gosh, no one's ever put a needle in my neck before. Yeah. I remember that feeling. So I like the IV for patients who need an alternative to that. Also, the stellate really does get the job done. But sometimes part of the way this therapy works, and again, just nutshell, is that we're looking to reboot and bring to balance the autonomic nervous system. So that's like a seesaw of our fight or flight, sympathetic, and rest and digest, parasympathetic. So patients, the therapy is an invitation. It's not a hammer. So my goal isn't to just strong arm sedate somebody with procaine. That's not how the procaine is meant to be used. And that's absolutely not the heart behind neural therapy. It's an invitation. So the stellate is all right, you're about to relax, whether you want to or not kind of thing. And so I've actually had patients who just didn't feel quite ready to receive the stellate, opt for the IV. But I find that the effect of the loopiness is dose dependent, be it IV or stellate. So I have patients who get tiny stellate doses and patients who get 3 or 4 times that amount. And we've worked up to that higher dose based on patient tolerance and preference. So it's just just nice to have a toolbox, because some people just aren't ready to receive this, or it feels like too strong of a relaxation response, or I like having both. And then sometimes absolutely. I occasionally will use both in one session for acute issues.
Yeah, absolutely. That was one of the cases I remember distinctly seeing with you we went from like literally neck, celiac, pelvic on a gentleman who was really struggling, really, really, really struggling. So it's fascinating to me to see how effective this can be with minimal side effects.
Yes.
So we talked about it. What do we treat? Mechanism of action. You kind of already hit a little bit about that. So you talked about the seesaw effect with sympathetic, which is run from a bear, someone's chasing you, go, 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 survive, to parasympathetic, which is rest, digest, which I always think is interesting in that in these couple of the celiacs that I got to observe is like that belly gurgles, like, and you're like, what the hell is that? And
It happens
you're like,
with all of them. It happens with the stellate. It happens with the pelvic. I joke with patients because they laugh when they hear it. I'm like, if I don't get a tummy gurgle, I'm not doing my job right.
Yeah. And so, I remember you said, well, we talked about rest and digest. And I was like,
That's right.
Okay. And I thought that was super, super fascinating. So basically, there's little hubs of neurons that are there's a plexus underneath the stellate. It's a plexus. In the celiac, there's another plexus. So imagine if you're a patient and you're listening, a plexus is kind of like a little command center of where all these nerves are kind of firing. And, it's like the operator lady with the telephone, right? So it's kind of like she's just making all these wires go this way. So what we're doing is we're helping rebalance and reset that by getting you from run from a bear to rest, digest, ovulate, procreate, calm down kind of thing.
Yeah.
So it's kind of basically it in a nutshell. Going on to kind of the next piece of it is, so when you're performing this procedure, what can a patient expect from like start to finish?
Sure. So if I'm seeing a patient for the first time, let's say that they're complaining of headaches, then I'm going to need to take a pretty extensive medical history and not just related to the headaches, because another really important point of neural therapy is not just treating the symptom, but there may be other factors that played a role in the instigation of that symptom that may seem unrelated. So, for instance, the first documented situation of this was by the Hunica brothers, where they were trying to treat a lady who had frozen shoulder. So they had injected Procaine around and in her shoulder. Nothing happened. It didn't get any better. She came back for another treatment and said that after the injection of her shoulder, there was a scar on her opposite leg that was tingling. And it was a scar from an osteomyelitis surgery that she had, which had seemed successful. But in digging deeper with the history, the frozen shoulder developed after that surgery. They injected the scar and her frozen shoulder disappeared within that treatment session and did not come back. So they termed the coin interference field. So I know this sounds kind of metaphysical, and to a degree, it is not well explained by medicine to date. But our best understanding is that we have this connective tissue covering called fascia that both separates and connects absolutely everything in the body, absolutely everything. So it's kind of like a cobweb of highways that are constantly communicating with one another. So for instance, a migraine headache might be coming on because of a terrible case of dysbiosis, or a root canal that needs to be revised, or a tonsil scar from childhood that has just been, again, to use a slightly metaphysical term, but stuck. That's it's the term that I like to use with patients because it just makes sense. These are devitalized cells that never healed following the surgery, the trauma, the infection, what have you. And it's connected. The whole body is connected, and it's so important that we see it that way. So I ask patients all about, past surgeries, past physical traumas, especially ones that might have had a mental trauma element to them. Going back to, for instance, tonsils, I've actually been a little surprised to learn as I ask these probing questions how many patients had complications after their tonsillectomies as children, bleeding, or it was scary, or, whatever the case may be. And so that's one of the more common interference fields that I uncover in asking a great deal of questions. So it's a lot of talk to start versus I try to understand exactly what all the areas that we'll be treating. And then, of course, explaining to the patient what the experience will be. So there are essentially three elements to neural therapy. And again, it just depends on the condition that the patient's coming in complaining of. So we have local treatments that go directly in the area of question. So for instance, if you have a tense muscle knot on your trapezius, well, then we're just going straight into that tense muscle knot. But then sometimes we're also doing more of a segmental approach. So this may involve little quaddles. That's our German term for a transdermal. I call it the mosquito bite injection. It's right under the skin. I mean, just right under the skin, so much so that it creates a little wheal, just like a mosquito bite would look like. And we may do those along the spine according to what we call a dermatome map. So this is a really neat map that you can Google and see a cool diagram of. And it just shows how the sensory nerves come out of where they come out of the spine and the paths that they take. So for instance, if you've got something going on in the hand, then it's probably coming from the C6 to C8 region. So that's just an example. So we may do some work there. And then again, perhaps around joints or into joints. And then, of course, the ganglion last. So if we're needing to do sort of a more broad universal type treatment that really involves the autonomic nervous system, then we'll include the deeper injections as well. And we'll talk all about that because my primary goal, apart from taking a detailed history, is to make sure patients feel incredibly comfortable about what the therapy is and why we're doing it and what it will feel like and how they'll feel afterward, just so that, they just feel very comfortable and confident about what we're doing.
Yep. So they come in, you do their initial consult, go over everything, get an informed consent, a good history. Let's say you're getting ready to do a stellate procedure. So patient comes in, you lay them on the table, you palpate the area that you're trying to find. Is that part uncomfortable at all?
No, I really haven't found it to be uncomfortable. If I am, so less so with the stellate, but if I am touching a place that is truly an interference field, it will often be more tender than other similar areas that I may be palpating. So tenderness is actually one of the signs that I'm looking for with physical exam as I examine, are there any clearly tense muscles on the back? Is there an area that seems to be getting more or less blood flow than the surrounding areas? Of course, any visible scars from anything, any infection, trauma, vaccine, whatever the case may be. I'm looking for all of those things. We do our best to minimize the discomfort of any injection by adding just a teeny bit of sodium bicarb. So this is just sterile baking soda, and that just works by balancing the pH so it's more neutral. So literally less acidic, it's incredible how much less it burns.
Sure,
we've
absolutely.
added that.
So one of the common hallmarks that we've gotten in the right space is, and I point this out because it's on our consent, is if we've done it, you should have gotten a Horner's response. So let's talk a little bit about what is the Horner's response.
Sure. So the stellate is actually, again, it's a hub of nervous system tissue, and there are three main nerves that are going through that hub. That's the vagus nerve. That's the one that we're truly targeting with this, but also the superior cervical and the pharyngeal. So when the superior, since we're going after the hub, all three nerves may take it up. But when the superior cervical nerve takes it up, then it brings about an increase in blood flow, because that's one of the things that Procaine does therapeutically is improve blood flow. So it improves blood flow to the entire side, because we just do one side at a time, of the face and neck. So we'll see a flushing and warmth of the cheek. The eye may also get ever so slightly bloodshot looking. And then the eye will actually get a fatigued look to it. And the mouth also may get a fatigued look to it. So I joke with patients. I say, I'm preparing you for this, but I show them a mirror after the change has come about so that they know it's not too scary. It's not stroke-like. And it's something to be celebrated because they got a therapeutic treatment. That's what we're looking for.
Yeah.
It's temporary, of course. So the Procaine effects of Procaine for most people last about 20 minutes. And at that point, the anesthetic effect is really wearing off, and the vasodilation effect is starting to wear off. But what's remarkable is So it sounds like, well, so I get this effect for 20 minutes. That doesn't sound very exciting or appealing. When we place Procaine around these cells that are just needing a reset button, a reboot, then we've actually improved the health of those cells so that they are less hair triggered by mental or physical stimuli in the future. So it's literally, we're literally improving resilience of the mind and body to life by using Procaine. Those effects last longer than the actual presence of the anesthetic Procaine in your body. So that's one of the other remarkable elements of the therapy.
Yeah. And it sounds like they can last month, 2 months, 3 months. I know some of the patients I had shadowed with both of you guys, and it was like, oh yeah, I got my last one 3 months ago, and I'm just now ready to come in. So it's so interesting to see, like, yeah, it's a quick, 30-minute procedure, but the long lasting effects is so great. Mm-hmm. As far as, do they need to have a driver when they come get this procedure done?
They don't. So we do have patients just hang out in the room with us for a few minutes until they feel that those changes have lessened. And they may feel loopy. Again, it just depends on their sensitivity to Procaine and whether they needed a stronger calming effect or not at that therapy that day. So we'll turn off the harsh overhead lights, and we turn on a little ambient dim light, turn on some ocean sounds, and just let them rest in the room, bring them some water. Procaine does make you thirsty. And just let them hang out for a little while. And I ask them to not touch their phones. This is meant to be a parasympathetic environment. So yeah, we just let them hang out with us for a little while, but they're perfectly capable of driving home. They have no activity restrictions, nothing. And I tell patients, it is always my hope and expectation that they will immediately feel the benefit, that the benefit will carry on to their sleep being improved, or they're just feeling calmer in general. So yeah, that's what patients expect.
Oh, that's perfect. What has been your best clinical case with utilizing neurotherapy?
I don't know that I have a single case. I think the most rewarding cases have been for PTSD. I have one precious patient in mind who used to have a friend drive her and sit in the room with her throughout her entire visits. This was prior to getting neural therapy. She was just that nervous about going anywhere or doing anything with a medical provider. Now she's completely independent. She drives herself. She looks forward to the therapy. She does still, of course, work with her therapist. She is still on psychiatrist-managed medications, but she's just gained independence. And I do give neural therapy entirely the credit for that, because she had all those other things prior to and was still really struggling. Just patients who walk in bent over with pain, and we do just the quickest little, almost painless treatment. They can stand up straight and they look at me wide-eyed like, I can't believe this. This is surreal. I'm like, I know, isn't it the greatest?
Yeah.
I loved a case where trigeminal neuralgia disappeared. It had developed with a post-viral or with the onset of a virus and lingered after the virus had gone. She ended up needing to get a root canal, but we discovered that because of the use of Procaine, because we do dental injections as well. So, let me see if I had any other reminders.
And so you had said, we were talking a little bit about the mental health. I think one thing that I think this could be great when patients are doing cognitive behavioral therapy, talk therapy, EMDR. I sat in on a case with Suzanne, and I was like, this is great, because it's almost like the neurotherapy can help like in a synergistic effect, kind of make EMDR work better, because now they have this like way of kind of switching into tapping into some of those feelings and emotions, so they can absolutely be able to kind of receive that type of treatment, which I thought was so fascinating. So fascinating.
I love that term. I come back to it again, even though it's not a medical term, of being stuck. And then the opposite of that is getting things moving again. So I know they've actually recoined fight or flight or freeze. So people can be literally frozen mentally, unable to move past a certain trauma, a certain memory, or again, of course, physical. So I've had a patient tell me that she felt like the therapy helped her to more objectively assess her situation and come up with more rational ways of handling it as it came to her, instead of having that fight or flight or freeze response that really just keeps you stuck.
Yeah, absolutely. So in the couple staff that I've done it on, the feedback I've gotten is I feel like I can take a deep breath, which I thought was good. And that was from one of my staff employees who worked as a ICU nurse during the pandemic. So saw a lot of crazy stuff, had to like have family say goodbye over the phone, like lots of PTSD from that. Yeah. I've had other nurses say like, it's kind of one of those things that I actually can't make like a bad thought. Like it's almost like they're trying. They're like, I can't really make a bad thought. My male nurse practitioner, he's like, everything is very clear. Like it's just clear, like a lot of clarity for him. And then another one of my patients actually who, it was interesting because he went a couple days, and then like Monday happened and there was something stressful, and he could tell himself that he had been so calm that he told his wife, I think I need one of those shots in my neck again because I feel like I'm already getting, stress, where I was like real cool for a week kind of thing. So it's interesting to hear just kind of like their feedback. I'm so mad at myself. I should have gotten one when I was there, but I was so interested in watching everybody that I didn't even think about myself. So let's talk about, where can people find you guys, Melissa? I'll link all your socials, but where can we find you?
Perfect. So our website is vinemedical.com. And we will be holding a workshop in November for practitioners who would like to learn more about neural therapy. This will be a hands-on event. That is imperative. It's one thing to read a textbook about neural therapy and another thing to actually do it, especially the ganglion injections. You can't learn those from a textbook. So we are planning on a hands-on event so practitioners leave feeling confident about their ability to integrate it, as soon as possible. Honestly, we'll answer all the questions about where to get the procaine exactly, all the things we've talked about and so much more to make it just very detailed, practical, applicable. That's one thing that I've walked away from a couple medical conferences thinking like, how do I apply this? That was a bunch of helpful textbook information, but it's not going to help the patients I see on Monday morning. So this is I call it a Monday morning therapy. I literally use neural therapy every single day. I've probably done, 1,500 stellates at this point alone. And that's, one therapy of many branches of neural therapy to help out patients because it's so applicable. So yes.
Yeah, absolutely. So the conference is set for, or the hands-on workshop is set for Friday, November 1st. It's a 2-day event. It's going to be at their practice at Vine in Georgia, and that's the 1st and 2nd of November. So it's a Friday, Saturday. I have it blocked here in my calendar because my hope, even though I've already been there, I might just go again because I think you always walk away with something good. Always walk away with something good. Plus, it's always good to see you guys. So I will tag all of that information in the comments. Thank you so much. I so appreciate you taking the time out of your very busy schedule, seeing all the patients and doing all these things to help listeners, practitioners, patients really understand how amazing this therapy is, this treatment with very, very, very little side effects and a lot of benefits. So thank you.
Awesome. Thank you, Lexi. I so appreciate you having me. It was a real joy.